Good afternoon, Stacy. It's Diana. I'm ready when you are. You're muted, Stacy.
Well, that's not great. Thanks so much for getting us ready to go. We will give it about another minute or so for folks to hop on. We're just a little shy of our meeting start time. And then we'll get going. Thanks for getting everything ready on your end. Okay, folks, it is, let's see here real quick. 12:35 according to my watch. So I will call today's Public Safety and Health Committee to order. Today is Wednesday, not quite September yet, still in August 25th. We are still meeting remotely, but there are still plenty of ways to be in touch and continue to participate in our meetings. And we encourage everyone to visit www.ci.missoula.mt.us/webcast. This is the central portal for seeing upcoming meetings, being able to join them, and seeing what public comment, our items are open for public comment and providing that. You can always also send us an email at council@ci.missoula.mt.us. That goes out to all members of the city council, or you can give us a ring and leave a voicemail that also goes out to all members of the council at 406-552-6012. Sorry, currently on the screen are the ways for if you are attending today's public safety and health meeting, you can participate. If you are here via the Zoom link found at the web address I named out earlier, you can just use the raise your hand function when it comes time for public comment. Or if you're on your phone and dialing in, you can press *9 to raise your hand, and again, *9 to lower your hand. And I will call you out by the last 4 digits of your phone number for those dialing in. Let's see. So we have Diana is staffing us today. If you wouldn't mind, I know there are several members of the council who were unable to attend today, but I see a couple are joining. So if you wouldn't mind going ahead and calling the roll, and I will let you know who I know for sure is absent when you get to that point, and then we'll kind of go from there.
Okay, starting the roll. Stacy Anderson.
I'm present.
John Contos.
I know he will be absent today.
Merta Becerra.
Present.
Heather Harp.
I am unsure if she's able to join us.
Jordan Hess.
Present.
Gwen Jones.
Present.
Julie Merritt,
Present.
Jesse Ramos,
I know he will be absent.
Amber Sherrill,
She also will be absent.
Sandra Vasika,
She also will be absent.
Brian Von Lossberg.
I am unsure if he will be joining us.
Okay, Heidi West.
Also unsure if, no, Heidi is unable to join us as well today.
Okay, thank you.
Yes, thank you for doing that. All right. We don't have a quorum, but we do have minutes to approve. So if those minutes are from our last meeting, which is August 18th, where we had an update from community engagement. Oh, Mr. Hess, yes.
We can't, we'll have to hold until next meeting.
Okay, that's what I thought.
Without a quorum.
Got it. All right. Diana, if you could make a note to make sure that the minutes that need approving from August 18th appear on our next agenda to approve those, I would appreciate it.
I will.
Thank you. All right, we have two agenda items today. The first one being just like toggling between screens here. We are joined by Assistant Chief Scott Hoffman to hear about the Edward Byrne Justice and Assistance Grant MOU. And so I will turn it over to you.
Thank you, Ms. Anderson. My name is Scott Hoffman. I'm the Assistant Chief of Police. Today I bring to this committee the Edward Byrne Justice Assistance Grant, that's referred to as the JAG grant. We put in for it every year. This year we have been allocated in the amount of $63,580. $14,676 of that is a pass through to the county. So we share some of this with them. They use that money for offset some of the wages for their property clerk. The remaining money, which is $48,904 to be used over 2 years, we will use that for what we currently use is called Secure Warrant. It's an online warrant program to where the warrants that we apply for can be directly passed on through secure emails to the judges to be approved and then back to us. We've been using that for a number of years, and we would use part of the funds for that each of the 2 years. The other monies that's remaining is used for online training subscription, for briefing training, additional online training policies and such. That is through the vendor of Police One. We've been using them for a number of years as well. So between those two subscriptions, that will take us through the $48,904 for the next 2 years. And with the pass through to the county, this memorandum of understanding has to be approved and signed by the city and the county entities for us to do that pass through. So we need to have a hearing for this and get it approved to continue moving forward.
Great, thank you so much, Assistant Chief. The motion or the item on the agenda today is to set the public hearing for September 13th, but we can take any questions or comments on that. Right now I see Ms. Merritt has her hand up.
Hi, thanks for being here, Scott. Just curious, why doesn't the county apply for its own grant money? Why do we apply for them and then give them a portion of the grant award?
It's just done that way through this JAG funding. They base it off of population. That's why we get more than they get. So rather than have them do the different entities throughout the state, they just give it to the bigger agency and then we pass through what they are allocated.
That makes sense. I'd be happy to make the recommended motion.
Great, thank you so much, Ms. Merritt. All right, we have no public in attendance at the moment to call for public comment. So any other questions or comments on the motion from my fellow council members? Seeing none. Diana, could you please call a roll call vote on the motion to set a public hearing?
Starting the vote, Stacy Anderson,
Yes.
Merta Becerra,
Yes.
Jordan Hess,
Yes.
Gwen Jones,
Yes.
Julie Merritt.
Yes.
We have 5 yeses and 7 absent.
Great, thanks so much. We will put this on the consent agenda for to set the public hearing with a note that quorum was not present, but we can still move forward with setting the public agenda. Thanks so much, Assistant Chief Hoffman, for bringing this forward, and have a great rest of your day.
Thank you.
Thanks. All right, folks, we have one additional item on today's agenda, and which is an informational only item, and we have a presentation in collaboration with the from our folks at the health department in the All Nations Health Center, and it's an information item about the prevention of underage cannabis use. Now that the Montana voters have allowed for recreational marijuana use for those over the age of 21, we want to make sure that we are keeping youth from getting access to that. So today we have a presentation from Leah Fitch Brody from the health department, and then Faith Price from All Nations Health Center. Did I get that right, ladies, with what your respective departments are?
Right. So I'm Leah Fitchbrody. Yes, I'm a substance use disorder prevention coordinator at the health department. Unfortunately, Lisa Biskevich could not be here today, but you see, there's a few people that are going to be on today. Faith will be joining us. She might be running a little bit late. She has been working with freshmen over at the university. And then we also have Shannon Sproul from United Way at the Substance Use Disorder Connect Coalition, as well as Steve Schmidt. He's our Drive Safe Missoula coordinator, and we are all part of the same coalition that is coming to present to you today called Healthy Missoula Youth. I'm going to be presenting a PowerPoint, if that's okay.
Sounds great.
Great. All right.
Ooh, before you get started, I see that Faith is here in the attendance. Can we, let's see,
Yes, let's do that.
All right, oh, I am the co-host, so I can elevate her, allow her to talk. So that hopefully would allow her to join us as
Perfect.
a panelist.
It looks like Julie's raising her hand.
Well, just for the sake of the record, could we get folks to put their names on there so you're all showing up as Lisa? The video record is our official record, so if we can get your names on there, that'd be great.
Okay, so it does look like Leah and Faith have theirs changed. So, all right, we'll let you get started while we work on getting those names changed for the record. Thanks for flagging that for us, Julie.
Great. Okay. All right. So like I said, we are with a local coalition called Healthy Missoula Youth. You may have known it as the Missoula Underage Substance Abuse Prevention Coalition before. It was MUSAP. We've been around for about 20 years. And this is kind of shows the various organizations that are a part of this coalition. We are a coalition of substance use prevention professionals who work in Missoula County. And so as you can see, there are many people that work with youth that are on here, also people that are, interested in behavioral health as well, and working with parents. So our vision for Healthy Missoula Youth is a thriving Missoula County where individuals and families feel supported by their community and are empowered to make choices that positively impact their health around substances. And so some of what we do includes kind of working with parents to talk with them about, how do you talk to your youth around substances. We do events where we bring people together and have conversations. We do trainings around substance use and the teenage brain. And we also encourage using evidence-based programming to really make sure that we're preventing youth use of substances. In terms of Montana, we do have an issue in Montana around substance use disorder. It's estimated that 1 in 10 Montanan adults has a substance use disorder. But unfortunately, we just don't have enough treatment available in our state, and only 90% of people who do have a substance use disorder aren't getting the appropriate treatment they need. And one of the best tools that we have in our state is to prevent early use of substances. So delaying onset of first use until the brain really matures can have a huge impact on whether or not somebody develops a substance use disorder later in life. We know that people who currently have a substance use disorder indicate that the majority of them started before the age of 18. So 90% of them started before the age of 18. And we know that 1 in 5 people who have a cannabis use disorder started early on, started in adolescence. We know that there are several different things that lead to early substance use, and that can be individual factors, like that can be, maybe there's substance use disorder or mental health issues in the family. There could be a genetic issue because we know that you are more likely to have a substance use disorder if you have it in your family. But also we look at kind of those environmental factors. So like in terms of drug availability, what are our social norms around that substance, as well as, how are we kind of really making sure that we are enforcing the laws that we have. Some of the substances that we really focus on with our group are alcohol, as well as vaping and marijuana. And just looking at, and I know you know some of this as well, because I know that you're working on the vaping issue, but looking at back in 2019, our youth were using alcohol on a regular basis. Those 38% of youth were using on a regular basis. And for vaping, it was around 39%. And then for marijuana, it's around 20%. And so those are the substances that our youth tend to use the most. Fortunately, in terms of Montana and across the US, youth have started using substances at a lower rate, which is really great. And so if you look at kind of the top part is alcohol. And so if you look at from 1993 until now, that has gone down, as well as smoking cigarettes. You'll notice that vaping, they just started tracking that. So that's still fairly high. But also in terms of marijuana, we haven't really seen that decrease though. So we have seen, it's not as high as maybe the alcohol use, but the concerning thing is that marijuana use has pretty much stayed the same, whereas other substances have gone down. So that is of concern to us. Another thing that we're concerned about here in Missoula County, and this is from our Montana Prevention Needs Assessment. So over the last 4 years, again, that bottom line shows that our use hasn't necessarily gone up very much. However, the perception of harm, so that meaning that, if you think about if marijuana would be harmful for them to use, the perception of harm has gone down, which then can lead to that early onset of use, that youth might be more likely to use something if they think that it's less harmful. Something else that we're concerned about is that potency in marijuana. And we have seen overall in general that marijuana potency has gone up in terms of the amount of THC, that active ingredient in marijuana. And so in 2000, we saw the average potency of most marijuana products being around 5%. That's gone up to 2017. Now it's more like 17%. As well as thinking about, if you think about concentrates, now concentrates are more like, dabbing and shatters. Concentrates can be up to 99%. Now that's the high end. But even in Missoula County, we do have, a local place that does sell something that's 98.3% THC. Some other concerning things that we know about is that other places that have legalized recreational marijuana in adults, they saw an increase in youth dabbing, and that doubled in Colorado. And then we also saw the sale of concentrates tripling in Washington and other states that legalized recently. We do have some concerns for cannabis and health concerns around youth. So and we're going to be going into some of the research around this in a little bit, but I just wanted to kind of go over some of the basic concerns that we have. So we're really concerned about both short-term and long-term issues around learning, attention, and memory, especially as it relates to, how they're doing in school. There's also been a tie between some behavioral health issues like anxiety. Even there's a higher risk of schizophrenia with long-term use as well. And then also a relation to suicidality. And then there's also issues around sleep problems. And then also that the issue around if you do start using a substance early on, that you may be more likely to develop an addiction as well. And also in Montana, unfortunately, we already have a fair amount of youth that are in treatment to marijuana, and more than half of the youth that are in treatment in Montana, it is due to cannabis use. And unfortunately, Montana already has the 5th highest rate in the nation for youth using marijuana. And we also have the 3rd highest rate of youth being diagnosed with a substance use disorder in the nation. So it could potentially exacerbate a problem that we already have. All right, so next I'm gonna call Steve up.
Hi, folks. Steve Schmidt here with Drive Safe Missoula. I'm in charge of the DUI Task Force and Buckle Up Montana Coalition. I was tasked to look at the density map for the cannabis shops here in Missoula. The Public Health Institute out of Oakland, California recommends that we have about 1 dispensary per every 15,000 people, which means for Missoula's population, we should have about 8 dispensaries, which would kind of look like the green dots that you see on the map right there. However, we are right now standing at 45 dispensaries within Missoula County as of 2021, which means Missoula actually has more dispensaries per capita than any other city in the country, according to a VeriLife report in 2020. There was also a recommendation to not have a dispensary within a 5-mile radius of a high school. And you can see all those green dots on there, every single one of those green dots is within a 5-mile radius of a high school. And of course, I'm obviously concerned about the level of impairment as people navigate our roadways driving vehicles. Thank you.
Thanks, Steve. I'm Shannon Sproul. I am the project coordinator for Substance Use Disorder Connect, which is an initiative through the United Way of Missoula County. And I'm going to talk to you guys a little bit about the research that we've found in looking at nationwide, but also a lot at Colorado and Washington, which are our neighbors and similar to Montana in many ways. According to a research study published in the Journal of American Medical Association's Pediatrics Journal, which was published in May 2020, marijuana is the most popular illicit substance in the United States, and adolescents and young adults are among the highest users of marijuana. Evaluating and researching the effects of marijuana policies on adolescents is a public health priority because of the potential adverse outcomes marijuana can have on youth, including an increase in the use of marijuana and other substances, new onset psychosis, suicidality, marijuana-related motor vehicle crashes, and neurocognitive decline over time, including educational underperformance. In another research study published in the JAMA Pediatrics Journal in February of 2017, researchers asked the question, how did the prevalence of adolescent marijuana use change in Washington and Colorado following legalization of recreational marijuana use? In this difference, in the differential analysis of almost 254,000 adolescents over 47 states, marijuana use among 8th and 10th graders in Washington state increased 2% and 4.1% respectively in those years. These trends were significantly different from trends in states that did not legalize marijuana. In Colorado, the prevalence of marijuana use pre-legalization and post-legalization did not differ according to this source. So the conclusion, among 8th and 10th graders in Washington, perceived harmfulness of marijuana use decreased and marijuana use increased following legalization. In contrast, Colorado did not exhibit any differential change in those perceptions or in past month adolescent marijuana use. Sorry, I'm stumbling over my words a little bit. However, a cautious interpretation of these findings suggests that investment in evidence-based adolescent substance use prevention programs in any additional states that may legalize recreational marijuana use. So that's us. Some more research that I found was through the Rocky Mountain High Intensity Drug Trafficking area, which transparency note is just that we received a grant from Rocky Mountain HIDA, and that pays for our grant at the United Way that created the Substance Use Disorder Connect initiative. But anyway, Rocky Mountain HIDA they publish annual reports since 2013, tracking the impact of legalizing recreational marijuana in Colorado specifically. And the purpose is to provide data and information so that policymakers and citizens can make informed decisions. According to a summary article written by Rocky Mountain HIDA and published in the September 2019 issue of Missouri Medicine, since recreational marijuana was legalized, traffic deaths in which drivers tested positive for marijuana increased 109%, while all Colorado traffic deaths increased 31%. Since recreational marijuana was legalized, traffic deaths involving drivers who tested positive for marijuana more than doubled from 55 in 2013 to 115 people killed in 2018. Since this information is not parsed out here, but by age group, we can only assume that youth under 21 are included in this number. More research about marijuana increases. Past month, the Rocky Mountain HIDA report indicated that past month marijuana use for ages 12 and older increased 58% and is 78% higher than the national average and currently ranked at 4th in the nation. And college age marijuana use increased 18% and is 48% higher than the national average, ranking 6th in the nation again. That last line, I'm skipping over that because that wasn't supposed to be there. More research on suicide. You may know that Montana is already has the second highest death rate by suicide in the United States. But since recreational marijuana was legalized in Colorado, the percent of suicide incidents in Colorado in which toxicology results were positive for marijuana increased from 14% to 23%. Pardon me, ER visits. Continuing in the Rocky Mountain HIDA article, the yearly number of emergency department visits related to marijuana increased 54% after the legalization. And specifically in regards to youth, Reuters reported in April 2018 that a Colorado study found that marijuana-related ER visits by Colorado teens were on the rise, and that between 2005 and 2015, the proportion of ER visits or urgent care visits by youth ages 13 to 20 for pot-related illnesses rose from 1.8 per thousand to 4.9 per thousand, which is almost triple, 2.72 to be exact. These graphs are from a recent report that just came out last month from Colorado, looking at evaluating all of legalization. And the top graph is about the perception of risk. And you can see that the younger kids are, the higher perception that they think using marijuana is a risk, and the older they get, there's less risk. But the second graph shows us that along with that, students' perception of marijuana being easy to get goes from, sort of lesser to bigger through correlation of that same time frame. I will point out, you can barely see it on this particular slide, but for instance, looking at the changes that happen, looking at the 6th graders and those little tiny steps at the bottom graph, that actually has doubled. 6th graders, 5% of 6th graders in 2013 thought that it was easy to get marijuana. Over 10% thought it was easy to get in 2019. So over 4 years, 4 years? No, sorry, 6 years. It doubled. So this also came from the Colorado report from last month, and this shows reported methods of marijuana use, smoking, eating, vaping, or dabbing, or some other way. And you can see that it's awesome that people are smoking less of it. But on the other hand, they're eating, vaping, or dabbing more. And in particular, dabbing, which you can see jumped from basically 20% to 52%, so 2.5 times higher with dabbing. So that's pretty concerning because dabbing has a pretty significant effect. Why is it an important consideration? According to the study by Ladegaard, Thurstone, and Rylander, maximum blood concentration after consuming marijuana edibles occurs in about 2 hours. Therefore, people may consume marijuana and not feel any effects initially. As a result, they may continue to consume and ultimately experience extreme paranoia and psychosis, which we've mentioned before. In addition, adolescent exposure to marijuana predicts up to a 2-fold increased risk of developing psychosis and schizophrenia in adulthood. According to the National Institute on Drug Abuse, there are adverse effects associated with marijuana use in any form, but concentrates in particular have very high levels of THC, which is the active ingredient in marijuana. THC levels are documented as an average of 54 to 69% and sometimes even exceed 80%, whereas other methods of producing THC is much lower at 39 to 60%. In comparison, the THC content in marijuana plant material, which is used in marijuana cigarettes, is much lower at about 15%. Thanks, Leah. So not only do concentrates have really high levels of THC, but dabbers inhale the entire amount all at once in a single breath. And as a result, concentrates can deliver extremely large amounts of THC to the body quickly. The risks of physical dependence and addiction increase with exposure to high concentrations of THC, and higher doses of THC are more likely to produce anxiety, agitation, paranoia, and once again, psychosis. Additional research is needed to understand the use of concentrate effects to these risks. So Faith?
Yeah, thanks. Hi, thanks for all that great information to my colleagues so far. My name is Faith Price. I'm a community prevention coordinator for All Nations Health Clinic. I'm working with youth on substance use and suicide prevention. So I know we gave you a lot of material. We also sent Stacy a 2-pager that has some of the highlights from all of this. So hopefully you've received that as well. But we just wanted to leave you with a few points to ponder and some potential avenues we could take as a community to prevent youth marijuana use as it becomes legalized within our state. So these points to ponder are: what specific steps do we have in place, or what is planned to protect our community as it relates to things like impaired driving, accidental ingestion and overdose, and substance use disorders, and the many other public health issues that we've seen happen in other states and communities. So we just really want to get this conversation started here in Missoula. What can we do here to better protect our youth? And will our public health related policies be based on current science and expert medical research? Is there a plan for public health surveillance activities to identify the needs and issues and gaps? Some of these other states, like Washington and Colorado, had built into their legislation that they were going to be reporting every 2 years on impacts of legalization. I didn't see that as something that Montana is doing. It might be something we would want to consider as a community. Yeah, thanks. Next slide. Yeah. So we don't have to start from scratch. There are all these other states and communities that have tried different policies, and there are public health institutes that have looked at what policies do work in reducing youth access and use. And we're also able to learn from the alcohol and tobacco industries and our experiences with them. There are a lot of lessons there. So one of those is that high prices do discourage youth. It's one of the best ways to reduce substance use initiation. So thank you guys for putting that resolution for an excise tax on marijuana to voters. That is one of the most effective ways to reduce use. And taxes have effectively reduced use for things like tobacco and alcohol and sugar sweetened beverages. We've seen that there. Secondly, don't allow products that are attractive to youth in shape or packaging or marketing. The marijuana industry is currently getting sued by the Mars Candy Company for making edibles that look like they're candy bars, which we know that advertising works, and the least amount of marketing that our youth are exposed to, the better. So that includes TV and radio and billboards, sponsorships, and product placement, which is one avenue that the industry has done a lot of on social media, getting influencers to use their products and place in their pictures. Number 3, prohibiting the use of flavor additives and limiting marketing of flavor names that are known to attract kids. As a group, we did take a look at some of the products that are available in Missoula on some of the dispensaries' websites, and you would be surprised at what's out there, honestly, and then like the THC potency. You'd be surprised at the names that they're using. It don't really sound medicinal, and right now that's what they're all supposed to be, is medicinal. Requiring buffer zones between youth serving facilities. I know right now currently we have buffer zones between schools and churches at 500 feet. The public health recommendation from Getting It Right from the Start, which is a research institute, their recommendation is 1,000 feet. And they say, in addition to things like schools and churches, which is what our legislation states, that we should be having buffer zones between all youth serving facilities, things like daycares and recreational facilities and parks where kids hang out. Limiting the number of retail outlets. You saw Steve talked about that. Those density limits are a huge factor in how much exposure youth are getting to seeing pot shops, thinking they're normal. And we have quite a few here, as Steve's slide showed. Prohibiting smoking and vaping cannabis indoors. So yeah, and in public places. Restricting public consumption, that not only it would reduce secondhand exposure to smoke marijuana, and it reduces the extent to which youth see marijuana use as normal and normative in our community. And then lastly, dedicating a portion of marijuana tax revenue to things like public health, public safety, and substance use prevention. We need to design and fund prevention and education programs aimed at marijuana use. So thank you. I think we have just a few minutes left for questions.
Thank you all so much. That was a lot of information. Some of it I was aware of, some of it I found surprising. So I will start. We have people queuing up. We still don't have any members of the public here, so just wanted to point that out for the record. I will start with Jordan Hess.
Thanks. Thanks for the presentation. The city has an opportunity to create some zoning regulations around this type of use as we see the recreational marijuana retail establishments. Well, not just retail and manufacturing and all the different facets of that. Based on your research, that last slide, Faith, was really helpful with some of the restrictions around youth serving facilities. But based on your research, do you have any thoughts on other things that might be useful as far as physically where these establishments can be located within our community, or anything that might kind of just from a land use or physical distribution standpoint, anything that might be helpful?
Well, I think it would also be useful to analyze, like Steve had that map of where they're located within our communities and paying attention to what neighborhoods are really inundated with shops would be one thing we'd want to look at, so that there's not one particular or a couple particular neighborhoods that really these kids are really getting exposed on a regular basis. And then, but also just paying attention, I think, to beyond just churches and schools, places where youth hang out, recreation facilities, etc. And I should have mentioned that those two resources on the right of that screen, like getting it right from the start, they have sample ordinances that cities can use, and they give a list of all of their public health recommendations that they've accumulated by looking at other communities. They're out of California, so they've done a lot of research in California, but they also help other states and communities who want to design their own ordinances. So they'd be a wonderful resource. And they have a lot of material already available online. And then that other group, Smart Approaches to Marijuana, also has a lot of recommendations that people can review and see what's happened in other states. But they really highly recommended, just in terms of density. I've seen another presentation at a conference I was at, that the higher the density is, the higher the use is for youth. That's kind of, I guess, would be expected and associated. So if youth are in a neighborhood where there are many pot shops, then they're more likely to be at risk for using more marijuana. So I think what we can do to reduce the number and the density within certain neighborhoods within Missoula would be helpful.
Yeah, that's really helpful. I think also, like you said, density within a neighborhood, or how far shops need to be from one another, or that kind of thing, could all be really helpful metrics. So, thanks. I will be, and so just so everyone's aware, there is an effort to work on at least an interim zoning code that would hopefully be able to be adopted by the end of the year, with probably a more comprehensive rewrite of that coming later on. And so we'll absolutely be in touch as that moves along to see if there's any recommendations.
Could I jump in actually and piggyback off that, Jordan? I was at a presentation probably a year ago in which they were talking about the Colorado and sort of the Denver area in particular. And another consideration might be exactly which neighborhoods, because what they found in Colorado is that more shops were located in low SES neighborhoods than in higher SES neighborhoods. And there were some negative effects about that. So just another consideration. I think if we were to look at the density map, you would see a lot of shops located very centrally in downtown and sort of north side area. Mm-hmm. And not very many, for instance, in the South Hills or near the South Hills. So just as examples, and just for another thought.
Yeah, that's something that, in terms of thinking about like health equity in that area. And another thing that we've been focusing on too, that we didn't mention very much, is the impact this could potentially have on our Native youth as well. We already see a higher rate of use among Native youth with marijuana. So.
Okay. Yeah, that's really helpful. I think I love the idea of tying zoning into some kind of health metric as well, or health equity metric or something. Okay, great. Well, like I said, I think that the community planning, development, and innovation staff are working on some kind of baseline information for a zoning code, and I'll make sure that everyone gets connected.
Great, thanks, Jordan. Great questions. Ms. Merritt.
Thanks, and thanks, Jordan, for that, letting us know that there's some actions in the works with regards to the zoning, because I will have to admit that while this has been on the back of my mind, there have been way too many other things that are front burner, and I have not been able to devote any brain power to thinking about what the city of Missoula is going to be able to do. And I guess as I mean, I really appreciate all the information that you folks just shared with us. That's really good to know. I think it is key, just like with the conversation we had around vaping, those some of the items that you brought up of not marketing to kids by, making and advertising products that are obviously directed at young people. I think that's important. And in fact, if I understand correctly, one of the shops downtown is just called Cookies. My husband sent the children there thinking that they could get cookies. So I find that, while I'm laughing about it, honestly, that's problematic. And so beyond maybe even the zoning, what I would love to understand from someone who could give us a little more information about legally under the Montana law, what we can and can't do in regards to some of those things. That would be super helpful for a future presentation. But I want to thank you all for being here today.
Yes, I was slightly confused. I was like, oh, there's a new cookie store. But the Frosted Glass gave it away. So Miss Becerra, you have the next question.
Thank you. Thank you so much for the presentation. Super helpful. As Ms. Anderson, I also knew some of this information, but you have provided us with an update on a lot of those numbers, and I appreciate that. I know that some communities are working on capping the number of dispensaries and increasing the fees for licensing to operate them. Do you know, or maybe this is another thing, as Julie was mentioning, for any future presentation or update, if you could bring us some of that information or point us in the right direction to find out what other communities are doing in terms of regulations for the number of dispensaries around, and also around the marketing. I think this is a little bit of a deja vu to the vaping work that we were trying to do, the marketing and how targeted it is to children, and it's not necessarily for the medicinal aspects of it, but more of the gummy bears, and the packaging and all that. So wondering, if you could bring us some information as to what other communities are doing to regulate all that, that would be much appreciated. But thank you for everything you brought us so far.
Faith, do you know the status of what's happening with the state? I know that they were considering updating the advertising regulations.
Yeah, they're currently, they just finished a public comment period at the state level. They're working through all the regulations on what legalized marijuana is going to look like at the state level. And so we're following that and paying attention, but they just finished a public comment period and a hearing on advertising and marketing and limiting it quite a bit from where it currently stands. So that was a positive. And we submitted some public comment in support of much of what they're proposing. I don't know that there's been a decision yet, as they just closed the public comment period August 23rd. So I'll have to look and see. I haven't seen anything new come across my email in terms of what they decided, but they had said that billboards wouldn't be allowed, radio and TV wouldn't be allowed. Basically the only advertising that the shops would be able to have would be through their websites, present social media. They wouldn't be allowed a social media site. And then the only big signage they could have would be right on their shop, no billboards. So it would limit it quite a bit, which we think is a positive.
And we would be happy to come back and present. And I think especially kind of figuring out what is the purview of the state and the Department of Revenue versus, what can we do locally?
Great, thanks so much. All right, well, this has been a great initial conversation. Sounds like we have some things that we want to follow up and dive into more as we kind of get figure out the new landscape we are in with a state that now legalizes recreational marijuana for adults. But it does sound as though there has also been ongoing efforts to address some of these substance abuse issues with our youth in our community, and we need to stay on that definitely. So thank you guys so much for taking the time to come and present to us, for the great work that you're doing and all the really useful information. And thanks to my colleagues for the great questions. And we will figure out how to get things more follow-up on the books as we proceed. So continues to be no public to call on for public comment on this. This was just an informational item, so there's no action needing to be taken. And so with that, I'm going to adjourn today's public safety and health meeting. This concludes the committee meetings we have for today. So thank you all for your great work, and I hope my colleagues have a great rest of the afternoon. Take care.